Okay, so we have Francesca here, is that right?
Yes, ma'am.
Okay, she is a 9-year-old, 90-pound Rottweiler here today for an ovariohysterectomy. Is that right?
Yes, ma'am.
Okay, and is it okay if we take Francesca to the back to get her blood drawn?
Yeah, I think so.
Okay, how does she do with handling and blood draws typically?
Some days she's good, some days she's bad. It just depends on her mood.
All right, well, we'll use our best judgment with her and do our best to make her feel comfortable.
Thank you.
All right, takes dog out of the room. Let's go, Francesca. Yay. All right, she walks to the back. Okay, draws the blood. All right, good to go. Here's Francesca.
Thank you.
Thank you.
How long will the blood test take?
Oh, sorry.
Come back.
It'll be about 10 minutes, and then we'll have a doctor in to talk with you about the blood results.
Perfect.
Walks out of the room. Runs the blood. Comes back in with the blood. Okay, we have Francesca's blood results.
How's she look?
Well, I'm going to be honest with you. We got some things we need to talk about here. Okay, so these first values, RBC, HCT, HGB, we have red blood cells, hematocrit, and hemoglobin. So we're in the low section, which means your Francesca is anemic, which means she doesn't have the appropriate amount of red blood cells in her blood to carry out her body's tasks.
Yikes.
So we have the number of red blood cells, we have the hematocrit in a sample, and then we have the hemoglobin, which is the iron concentration. Those are all low. Below that, we have mean corpuscular volume, which is the amount of red blood cells in a blood sample, which appears normal there in the sample. And then we have the mean corpuscular hemoglobin, which is the amount of iron in the blood sample, which these appear normal right now, but as a whole in the body, the red blood cells are low. Down here, you can see the mean corpuscular hemoglobin concentration as a whole, which shows that is also low, which shows that the iron within the cells is low. All right, then we have our reticulocyte counts right here. We have the percent reticulocytes at 8.2%, which greater than 1 shows regeneration, which is good. It shows that she has a regenerative anemia, which means her body is producing immature red blood cells to compensate for the loss. So we have the reticulocyte count, which is high, which it should be high if the body is regenerating, because you want more red blood cells. But we do have hemoglobin reticulocyte. The hemoglobin within the reticulocytes is low because they're immature. They don't have the iron to compensate here. Then we have our white blood cell count. You have your main 5 white blood cells, neutrophils, lymphocytes, monocytes, eosinophils, and basophils. Those are all within normal range, which is good. That shows us that Francesca does not have an infection today, so that is one thing that is a plus. Now, here's another issue we're seeing. Our platelet count is low. So the best option for today is to postpone the surgery.
Why can't we do surgery if the platelets are low?
Well, you see, platelets are the clotting factor within the blood. Because Francesca has a regenerative anemia, just because her body is working harder to make new red blood cells, doesn't mean that we should go in and do an invasive surgery on her, because 1, she doesn't have the red blood cells to carry oxygen to the rest of her body and her organs. And on top of that, we don't want to create a wound where her body may not be able to clot blood or heal itself properly, and that can lead to her having excessive bleeding, and we do not want that.
Gotcha.
So we have low platelets here. That's dangerous. We do not need to cut into her. Then we have the mean platelet volume, which is high for the blood sample. And then below that we have the platelet crit, which is kind of the same thing as the hematocrit, It's a packed cell volume. You can see that's also low. It shows the platelet count. All right, and moving on to the chemistries, we have our glucose, which tests for the sugar in the blood. That's normal. That's good. Shows us that you do not have a diabetic Rottweiler. Then below that, we have our kidney values, creatinine, BUN, which is blood urea nitrogen, and we have our phosphorus. I'm going to be honest with you. These are off the charts. Your dog is in kidney failure or is presenting signs of kidney failure. She's 9 years old, and this presents another complication before surgery.
Can we fix the kidneys?
Well, see, we don't have dialysis in dogs. We only have fluids. So we can try and run these numbers back down. And you see, these numbers are high because the body is not able to excrete the byproducts of protein. So it's building up in the body, causing this number to increase. So we can run some fluids to her. But the issue there is if we're running fluids to her and her red blood cell count is already low, we're going to dilute the blood even more. So we have some issues to work around here. We're kind of fighting two battles. So it's going to take some time to really decide when the best time to spay her is. Granted, she does not have an infection, so that's good. That shows us that she does not have a pyometra right now, because that is a life-threatening condition that would need to be treated. So I think the best case in this scenario... Actually, before I get ahead of myself, let me finish the blood work. We've got our calcium, total protein, albumin, globulins, ALT, ALKP. These things show our kidney and liver functions, which below that, aside from the kidneys being totally off the charts, the rest of those values are within normal range. So that's good. Our main focus is the anemia and the kidneys. And then down here we have a high amylase, which typically can show early onset sign of pancreatitis, but in this case...
Is it different? Why is the amylase high?
Well, the amylase is high most likely in this case because the kidneys process amylase out of the bloodstream. And you can see if the kidneys are inflamed, it would have a harder time excreting that. And then your lipase is normal, so that's good. You don't want extra fat enzymes in your blood, which could also lead to the pancreatitis. So we don't have those issues. So in my opinion, the best thing to do is to hospitalize your Francesca for maybe 2 to 3 days, depending on results. We'll check her blood each day and see if we can get these numbers back to normal.
Okay.
So this is why it's very important that we run pre-surgical blood work to catch any underlying conditions that your Francesca may not present to you at home. So she looks good now as a dog, but on paper she's showing signs that typically a 9-year-old, 90-pound Rottweiler could present.
I appreciate you checking her out.
No problem. And not only do we run these to catch these issues, but we run this blood to make sure that our anesthesia is safe for your dog. If your dog on its own cannot perfuse oxygen throughout the body, it makes it even harder for the body to process the anesthesia. 1, with your anemia that Francesca has, and 2, with the kidneys, which the kidneys and the liver are the organs that process the anesthesia out of the body. So Francesca would have a much harder time waking up from anesthesia, and we don't want to put her at more risk than she is.
I understand.
Thank you for your time. So we'll take Francesca to the back, and do we have your correct phone number here?
Yes, ma'am.
270-252-4578? Mm-hmm. Okay. All right. We're going to get her going with some IV and some medicines, and we'll be in touch with you.
Thank you.
Thank you. Have a great day.
You too.